Welcome everyone, and thanks a lot for joining us for our discussion today on the equity and greenhouse gas effects of an electric car sharing pilot in rural disadvantaged communities in California's Central Valley. My name is Mike Centetos. I'm the Policy Director for the National Center for Sustainable Transportation. I'll be moderating the webinar today, and before we get started, I'll just do a quick introduction. This is part of our monthly webinar series that we sponsor here at the National Center for Sustainable Transportation. NCST is part of the University Transportation Centers program administered by the U.S. Department of Transportation. We're a consortium of 6 universities from around the country focused on advancing environmentally sustainable transportation through cutting-edge research, direct policy engagement, and education of our future leaders. Today's webinar will last an hour and 15 minutes. We'll have a presentation from Dr. Caroline Rodier from UC Davis. And then we'll hear from 2 guest respondents who have been intimately involved in this project. We're really happy to have them join us today. Abigail Solis of Self-Help Enterprises and Creighton Randall from Mobility Development Partners. And then after those 3 short talks, we'll open it up for Q&A. We have a Q&A feature at the bottom of the screen of the Zoom webinar platform, so feel free to enter in your questions there as we go along. We'll do our best to answer all of them. We will be recording the webinar, and the recording will be available along with the slides on our website following the presentation. Before we begin, we're just going to do a quick poll to get a sense of who's with us and what you'd like us to focus on today. So you'll see those 2 questions pop up, and we'll just ask you to take a second to answer those, and we'll display the results a little bit later on. So with that, let's jump into our presentation. Our first speaker is going to be Dr. Caroline Rodier. Dr. Rodier is a researcher at the Institute of Transportation Studies at the University of California, Davis. And Caroline, I will turn it over to you. And you're on mute.
Thank you, Mike. Okay. So I'm just going to start out by giving you a bit of description on the flow of the webinar today. I'll start with a description of the pilot and early research findings. This will be followed by Abigail's discussion of community needs and engagement. And then finally, Creighton will discuss business models and operational issues in the larger context of shared mobility services that serve disadvantaged communities. Okay, Míocar is an electric vehicle car sharing service located at affordable housing developments in rural low-income communities. Míocar is a nonprofit and is currently funded by the California Air Resources Board. Míocar is also a round-trip car sharing service. That means you pick it up at one location, take it out and use it for your travel, and then return it to the same location. So Míocar is located in the southernmost counties of the Central Valley in Kern and Tulare counties. It's located in 6 communities in 8 affordable housing complexes with charged parking spaces. It includes 27 electric vehicles with ranges that are suitable for a rural driving environment. These are Chevy Bolts, BMW i3s, and Chrysler Pacificas, and we did purchase these vehicles slightly used. The service cost is $4 a day, $35 per weekday, and $45 per weekend day. Plus, if you travel more than 150 miles on a reservation, you'll be charged an extra 35 cents per mile. Member requirements include being 21 years old, submitting a debit, credit, and prepaid card account, and having a clean driver's license with no major incidents. So the San Joaquin Valley is located in the Central Valley, however it excludes the Sacramento region. People outside of California are generally not familiar with the term San Joaquin Valley. However, we in California are. So I'm just kind of letting you know that this is the study area that I'm going to be talking about today and referring to it as the San Joaquin Valley. And you can see that the Sacramento region is just north of the boundary for the San Joaquin Valley. So the San Joaquin Valley is California's single most productive agricultural region. It produces one of the most, it's one of the most productive in the world. It produces more than half of the fruits, vegetables, and nuts grown in the United States. So in this map, you can see that the valley is dominated by agricultural lands, and the smaller pink areas are residential and commercial lands that are actually developed. California has classified most of the San Joaquin Valley as economically and environmentally disadvantaged. It also has some of the worst air quality in the nation and high rates of childhood asthma. So I'm just going to move on now to discuss our origin story for the project. The San Joaquin Valley Transportation Agencies, the MPOs and transit agencies, wanted to develop a path to increase access and reduce greenhouse gas emissions in rural areas in the San Joaquin Valley. This was approximately between 2013 and 2014. Rural areas, as many of you know, are particularly challenging for transportation planners because it's difficult to provide high quality fixed route transit in areas with dispersed and low density development patterns. Thus, personal vehicles are often essential to accessing most destinations. However, they are also often beyond the financial reach of very low income households. The Valley MPOs partnered with UC Davis researchers to embark on a community-based planning study that explored shared mobility options that may be able to, address this challenge. The project was funded by the California Department of Transportation. It included stakeholder outreach, data collection, and analysis to identify transportation disadvantaged communities who wanted and could potentially benefit from new services. It compared shared mobility service concepts and developed community partners. It culminated in a consensus on 3 promising pilot options, one of which was Míocar that I'm going to discuss today. The pilots were ultimately funded by a grant from the California Air Resources Board. Okay, our data collection methods for evaluation. These include member use data and surveys. Member use data includes data on each member reservation, including the date and time of the reservation, revenue, duration, and distance traveled. And we were provided access to the complete data set by member using a confidential code by the operator. The initial survey is administered when a user joins the service and includes questions related to personal vehicles that are available to the members, member socioeconomic attributes, members' reason for joining the service, and their expected use. For our 10-month ramp-up period, we had a response rate of 4.4%. The post-use survey was administered after members completed a reservation. We asked in this survey what was the primary purpose for travel during this reservation, how many people were traveling in the vehicle, what was access mode to the Míocar hub, as well as counterfactual travel. So that is how you would have traveled to accomplish the activities that you did during your reservation if there was no Míocar. And so we had a response rate of 32 members and 17% of all trips. So again, I just want to highlight that before presenting the results today, that, this is about the initial ramp up period. These results are largely descriptive and exploratory. Sample sizes in some cases are still small. However, we are still collecting data and working to improve our data quality. Okay, early exploration evaluations, 10 months, and our 10-month period happened to end in March of 2020 when the COVID shutdown began to hit. This data actually includes some of the effects of that shutdown. So you can see in this slide the gradual introduction of use of vehicles in the Míocar fleet from 1 to 27 electric vehicles and the increase in vehicle use. In this slide about Míocar members, the blue line is growth in members who use the service at least once. The red line includes members who made a reservation during a service month. Membership levels increased from 0 to 153 members. In total, 776 individuals began an application for the Míocar service, and 153 of those actually became members. They completed the application process and were accepted. 108 of those actually used the service at least once, and 45 people were not yet able to use the service as at the time we ended this data collection period. So the purple line in this slide on reservations in VMT plots monthly VMT and reservations. The median reservation distance is 46 miles and the duration is about 4 hours, excuse me. Okay, the initial survey results indicate that our members belong to households that have relatively larger household sizes, lower medium incomes, and lower vehicle availability compared to home counties and the values for pilot census block groups in which the pilots are located and members live. Okay, user profile data. We were able to integrate the socioeconomic data on member attributes with their user data. We were able to, come in, do some initial insight into more important factors that predicted the frequency of use of Míocar. And we saw that having 3+ adults in a household was important to high frequency use, lack of access to vehicles or vehicle insufficiency, and having a household adult that earned less than $15,000 per year also contributed to high frequency use. Okay, this slide shows our survey results, which indicated that the average and medium age of household vehicles were over 10 years old. However, vehicle age ranged from a low of 2.5 years to a high of 23 years. Most respondents indicated that they joined the service to meet unmet needs for access to a vehicle or to save money on vehicle travel. And you can also see from the slide that about 19% joined as a backup in case their car broke down. This is kind of consistent with the age of vehicles used that were available to members through their household. Okay, we were also provided with data on the census blocks in which Míocar members live. In this map, you can see that the green dots represent Míocar hubs and the size of the pink circles represent membership levels in area communities. Many members live outside of the Míocar hubs, and many of these communities are some distance from the Míocar hubs. So here we use the same data to calculate driving distance from members' home census block to the nearest Míocar hub. This is the distance distribution you're seeing right here, and these are for user members. Not surprisingly, 27% were willing to travel more than 5 miles from their home to access Míocar hubs based on our previous slide. The average distance is 7 miles and the median is 2 miles. The maximum distance was 39 miles. So mode of travel to Míocar hubs. This slide shows expected from the initial survey and stated from the post-reservation survey mode shares to Míocar hubs. Again, these results are consistent with distance from home locations to Míocar hubs. Walking or private vehicles are the most common access modes to hubs. However, some are also using transit to get to the hubs, as well as taxi and ride-hailing services. Okay, we asked members after they completed a reservation what was the primary purpose of the reservation. And we see that, this was somewhat surprising to us that we saw relatively high frequency of work-related trips. We think that this may reflect kind of unreliable access to a vehicle for many reasons, or the need to share a vehicle with another household member. Okay, new travel possible with Míocar. So this slide and the next one use the counterfactual data that we collected on how travel by Míocar would have been accomplished without the presence of Míocar. So this slide documents results relative to new travel enabled by Míocar. Over half of respondents expected and stated that their travel with Míocar would not have been possible without the service. This suggests that the service is increasing access to opportunities for Míocar members. So the post-reservation survey asked users who indicated that they would still have traveled, even without access to Míocar, how they would have traveled. So we see here that 95% indicated that they would have used a different mode, and that mode would have been a personal vehicle or a car rental. So we weren't substituting for transit use or walk and bike, at least for the sample that we have right now. We did see that 5% indicated that they might have chosen to travel to a different destination, however. Okay, change in conventional and electric vehicle VMT. So we use this counterfactual data from the post-reservation surveys and applied it to member user data. And the results suggested a 15% replacement rate of conventional, gas-powered VMT with electric VMT, and a 75% generation rate for new electric vehicle VMT. Interest in electric vehicle ownership. So these results are from the initial survey, and these suggest that there is some curiosity about electric vehicles among new members. Electric vehicle ownership is very, very low in Tulare and Kern County and most of the San Joaquin Valley, despite what many may, significant incentives for vehicle purchases. So I'm going to start concluding now. These are our preliminary observations. So again, I want to highlight that these are early results and they are exploratory, but our sample sizes are growing and the survey response rates are headed towards 50%, which we are pretty pleased about. The service is currently underutilized. We believe that this is due to the challenging service location, reduced activities because of COVID-19, and relatively high fares. I mean, given the low income in these communities, ideally we could charge a bit less, but we are trying to create revenues for the service. Talk about that a little bit later. However, the service does appear to address some transport inequities in the community. We're pleased to see these results. Members belong to households with lower incomes and fewer personal vehicles. The frequency of use is inversely related to income and personal vehicle access. Members largely make trips that they could not make without the service. That really suggests that there's a huge need in this area. So what about greenhouse gas reduction and VMT effects? So we can see that members do not appear to be substituting Míocar travel for transit travel, at least with this data set. This addresses significant local concern for transit agencies. And these results are actually intuitive given the low income levels and the relative costs of transit and Míocar. Transit uses is very affordable in these two counties. And also the service is round trip rather than one-way car sharing. One-way car sharing is more likely to compete with transit. Members may be increasing transit use by traveling to Míocar hubs, but they are also driving to these hubs. Very approximately, we see right now for every 1 mile of conventional VMT replaced by EVs, there are 5 new electric vehicle miles generated. So we haven't had enough time to measure change in household personal vehicle ownership. There are potential for larger reductions in greenhouse gas emissions and even VMT from changes in personal vehicle ownership. There are suggestions that this may in fact be possible. Transportation costs make up a large share of limited household budgets in this area. User data shows that some members are really using the service very frequently, and it looks to be almost like a personal vehicle. Míocar also has the benefit of educating community members about electric vehicles, which could increase purchases. Okay, so some final thoughts here. Our pre-pilot evaluation that I mentioned early on in this presentation showed that there really is no easy way to expand access to low-income rural populations. Car sharing and volunteer ride sharing, based on our analysis in the study area, proved to be most promising. Increasing access to address the need of transportation disadvantaged population is really likely to increase travel. But the use of electric vehicles can mitigate and even reduce greenhouse gas emissions. More research is needed, as just described. I'm going to my final note are that programs may require ongoing public support. In the meantime, our project partners are exploring approaches to increase revenues. We're interested in testing hubs in more central urbanized areas to help offset the cost in more challenging locations where there is significant need that really needs to be met. And we're also looking at group memberships for organizations that need to help their client travel. And I just want to acknowledge my co-authors for their important contributions to this research, Brian Harold and Yunwan Zhang of ITS Davis, and a special shout out to Gloria Huerta, the general manager of Míocar, who has really helped us fine tune our implementation of survey instruments and maybe really helping us to improve the quality of our data. And then of course to all our project partners, especially Kern COG and Tulare COG, the California ARB, Valley Air, Self-Help Enterprises, and Mobility Development. It's really been a privilege working with all of you. Okay, so next is Abigail.
Thanks so much, Caroline. And Abigail, before you jump into your presentation, we're just sharing the poll results really quickly so we can get a sense of what folks are interested in hearing most about and where folks are coming from. So thanks for filling that out. Caroline, thank you so much for that early look at how the service is being used we're getting some great questions so far, and I want to encourage folks to keep asking questions. One question that I was hoping maybe we could just address quickly, because I think it's important context before we get into our next presentation, is a question about who can access the service. And maybe you touched on this, but is the service restricted to people who are living like in the immediate area of the hubs, or is it open?
Oh, I'm sorry. I got distracted there. Could you ask it? I'm so sorry. I was looking at the chat box.
Just the access to the service, whether it's restricted to folks living kind of in the immediate vicinity.
No, it is
of the
not
hubs.
restricted to people, no, living at the affordable housing complex. I think there's research and data available that's not necessarily that kind of, especially with in our study area, there would be not enough usage to support it in just among residents in the affordable housing complex. Okay,
thank you for clarifying that. Okay, well, so with that, let's turn to our two guest respondents who we're thrilled to hear from today and hearing about their experiences in getting this pilot off the ground. So first, we're very grateful to be joined by Abigail Solis, Sustainable Energy Solutions Manager at Self-Help Enterprises. Self-Help Enterprises is a nationally recognized community development and affordable housing organization, and they host several Míocar hubs at their multifamily affordable housing sites in Tulare and Kern County. So Abigail, thanks so much for joining us.
Thanks, Mike. Thank you to everyone who has tuned in today and watching and wants to learn more about Míocar. Definitely this is something we're very proud of and excited to be sharing with you today. Like Mike mentioned, I'm with Self-Help Enterprises, and my goal today is to help you better understand the community need around this project, as well as community outreach, engagement, education, and how equity really plays into projects like these. So I will be having assistance advancing my slides. So next slide. A little bit more about myself and Self-Help Enterprises. So Self-Help Enterprises is a nationally recognized community development and affordable housing organization. We are located in the San Joaquin Valley across 8 counties. And since 1965 have touched the lives in one way or another of over 55,000 families. Our mission is to work together with low-income families and to build and sustain healthy homes and communities. At Self-Help Enterprises, we really care about the residents' experience living at our affordable housing complexes. And we also work very closely with residents that live in disadvantaged communities outside of our housing projects. We work with small disadvantaged communities across the San Joaquin Valley on multiple infrastructure projects, and we help them to address multiple infrastructure needs. So I'm really hoping today to give you a sense of what it's like in the San Joaquin Valley. I will say that I know that the word disadvantaged community is not the best word to use to describe these communities. Some folks do not like to use that word. I've heard various different descriptions of how to describe under-resourced communities, but for this presentation, I will be using the word DACs, or disadvantaged communities. During my work in communities and working side by side with low-income residents, I've had the opportunity to really talk about their needs over the last 10 plus years. And we've had multiple community gatherings and meetings to help communities identify their needs and address their priorities. And as we did this work for many years, transportation came up as a top need in rural communities. We know that these communities are dealing with multiple issues. These are the communities that are dealing with high energy costs because either the home that they live in is maybe doesn't have great windows, it doesn't have great doors, it needs work, and it's not very energy efficient. So we know for that reason and other reasons, energy costs are higher in lower income communities. We know that these are the same communities that are dealing with contaminated drinking water. We work with over 250 small communities and schools to help them address their contaminated drinking water issues. So we know that this is happening in these same communities. These same communities are those that are dealing with the effects of air pollution, because many residents are still using propane to heat their homes, or they're burning wood to fuel and heat their homes. And for many other reasons, in the San Joaquin Valley, there is high air pollution. We know that there's very negative impacts that come with this. For example, high rate of asthma among kids and really adults, valley fever, many other respiratory illnesses, and of course, most recently, COVID-19. We know that disadvantaged low-income communities of color have been affected by COVID-19 at higher rates than other types of communities, and that has very much been the experience that we've seen here in the San Joaquin Valley. As we did this work, we learned that because rural communities are located further away from things like work, school, and clinics, hospitals, it took longer commute times to get to destinations such as these. And for many years, and even today still, we know that there are very limited transportation options in these communities. Typically what we saw is that residents used either a bus service that came by maybe 2 to 4 times a day, or they paid for taxis or paid for someone to give them a ride to where they needed to go, which was very expensive, like Caroline mentioned earlier. These high cost transportation options really are inequitable when you think about who's paying for this transportation, being that they're the lower income communities, some of the lowest across the state, maybe even the country. The other thing we learned is that these transportation options are very inconvenient, along with being expensive, because if you only have 3 or 4 times to bus stops in your community, you have to catch the bus at that time, or else you miss the bus, right? So people would have to rearrange their day to really make that bus schedule. Since we started to do this work, definitely the local transportation agencies have tried to increase bus stops out in these communities, which we really appreciate. But we really found, like Caroline mentioned, that Míocar really augmented people's use of public transportation, like local bus services in town. Next slide. As we rolled out Míocar, more and more, Míocar began to be a trusted community resource. It is convenient because it's located locally. It's affordable. Some people may not be able to afford the $4 an hour, but we saw that, most, if they had to choose between the $4 an hour or paying for a ride, which can cost anywhere from $50 to $100, depending on how far they need to go, of course, they're going to choose the $4 an hour. What made this very trusted and amongst our communities is that it's available to our resources. To our residents. We found that by opening up Míocar, not just to our residents who live in our affordable housing, our multifamily housing units, but to make it available to the entire community was really the right thing to do, because we know that the need goes beyond those residents that live in our multifamily sites. And we have seen that we have many members that live throughout the community, as well as neighboring communities. We have some folks who traveled from, they found a ride from the neighboring community to the community that has our self-help hub, got dropped off there and picked up the vehicle at one of our self-help sites and used it and brought it back there. That's how important it was for them to get to our site. One thing that we also learned as we began to implement Míocar is that it was used not only by residents, which we expected, but also local businesses and agencies became users, became members. also schools and clinics, all found a reason or a need for a service like Míocar. You know, when you think about a hospital or a clinic that has that needs to bring patients to and from their medical appointments, having a service like Míocar is really helpful. Also, we have, we had interest from schools who, of course, have to transport families to different type of appointments, as well as local businesses and agencies, workforce development agencies that need to find ways to transport, their participants to and from trainings, schools, and also to work. Míocar really became an option, a viable option to just about anybody in these communities. Next slide. So I think I wanted to make sure to really focus and call out the importance of education and capacity building in this project, as well as other projects like these. It's important to realize that when you are implementing an electric vehicle, any electric vehicle project, but even more so a car share service, the entire concept is new to the residents that we're focused on here. And because of that, it's important that we understand that this is going to take education, time to help people build their capacity around the entire project, whether it's teaching them, how to explaining to them what the car service is, what the car sharing service is, right? It's similar to Uber, but it's not the same. We found ourselves doing, small group education events like the one pictured here outside at one of our sites to explain the program, to talk about how to download the app, to talk about how to use electric vehicles, everything from unplugging the charger to plugging it back in when you return the car. Explaining to people how you drive electric vehicles, that basically it's the same as driving, a regular car with, just a few slight modifications. And a lot of times we were even providing test rides to residents who it was their first time in an electric vehicle. All of this really helped them to become comfortable with the concept of an electric vehicle, and it helped them to realize that they can use one, they can drive one, and become a member of Míocar and use this electric vehicle to help meet their transportation needs. Next slide. Míocar would not have been as successful as it is without the community partnerships that we established as we started the program. Obviously, all projects and all services need to advertise, but how you advertise and how you use your marketing dollars is very important. We decided to use our resources to build partnerships with schools, with clinics, as well as with the cities and the counties that we are working with. This is a picture here of myself and the mayor of the city of Wasco that has three Míocar sites, excuse me. So we use these partnerships to help spread the word. We know that schools and clinics and cities and counties, they come in contact with residents every day. So bringing them on as partners really helped them to spread the word, as well as they became members and used the service themselves. So that was just an added benefit. When you're working in disadvantaged communities, it's very important to be knowledgeable and respectful of cultural norms, as well as understand that you need to be using trusted messengers to get the word out about new projects, new concepts like these. We used trusted messengers. We had community events. We made it easy to participate in and learn more about our Míocar program. Next slide. I want to really focus just a little bit on California's clean energy goals. Many of you are familiar with the state's goals for the year 2030 and 2050. You know that the governor really wants to significantly reduce greenhouse gas emissions over the next couple of decades. We know that we cannot reach our state's clean energy goals without including disadvantaged communities. It is impossible. These communities, unfortunately, are using, more. They're burning wood. They're using propane. They have higher energy costs. We know that we need to bring them along with us if we want to be successful in this transition towards our clean energy goals. For that reason, it's important that instead of doing what I have traditionally seen in my work, where disadvantaged communities are an afterthought, the low-income communities are those that we reach out to after everyone else has already come on board. I really want to encourage all of you out there to consider starting with disadvantaged communities. These communities, like we've learned in with our experience with Míocar, if you take the time to provide the assistance, to provide the education, they can use electric vehicles, they can use clean energy options, and they will see the benefit of it, and they will become regular users just like more affluent communities across the state. So I want to encourage you to start with disadvantaged communities. It really is the only way that will meet our clean energy goals of the future. Next slide. I just want to touch a little bit on funding and policy. Like I mentioned in the previous slide, we really need to be prioritizing disadvantaged communities. The state has done a great job at making sure that they're set aside for disadvantaged communities for their electric vehicle funding as well as clean energy funding, but we can always do more. There is so much more work to do. If you come to the San Joaquin Valley and you pick any community to walk around and tour, you're going to see very limited rooftop solar. You're going to see hardly any charging stations. You're not going to see electric vehicles because there's just so much more work to do. We know that we need our funding and our resources to cover the cost of electric charging stations. We know that the infrastructure is not always in place in these rural communities, and we need to identify that up front and realize that we need resources to install that infrastructure if it's not already there. We need incentives, I believe, for partnering with low-income housing, like self-help enterprises. Not all multifamily housing providers are willing to do that. But I think if the state prioritizes incentives and makes it financially make sense for multifamily affordable housing to do this, I think that we'll see more interest in these types of projects. We learned that we need to be funding for technical assistance, like the assistance that we provided to our residents, as well as the community, to help them really understand these projects and engage and then actually participate. All of these things are very important if you want to have a successful project like this. And I think that these are things that we really need to be focusing on across the state and ensuring that our funding and policy include. So this is my contact information. If anyone has any questions about how to engage with low-income residents, disadvantaged communities, multifamily housing, I'm happy to answer any questions as we go. So thank you, Mike.
Thanks so much, Abigail. That was a great presentation. Certainly clear to me, I think, how much effort it takes to make a service like this successful and accessible to the community. So you and your colleagues should be commended for everything you've done.
Thank you.
I want to turn next to our final speaker before we open it up to Q&A. That would be Creighton Randall. He's the Chief Executive Officer and Principal Consultant for Mobility Development Partners. And Creighton has been involved in launching car sharing and other shared mobility programs all over the country, including Míocar. And Creighton, we're very much looking forward to hearing your perspective on this pilot as well, and hopefully some more global context.
Thanks, Mike. And I'll try to keep it quick. I've got a short slide deck here. I know we're hoping to get to questions here. So just a few notes on us. Next slide, please. So we are about a 3-year-old organization, although as Mike said, several of us on the mobility development team have been doing this work for a little over a decade. We operate in 4 states. And what we've seen in the last few years is really a ramp up in public investment, as Abigail said, sort of that really encourages communities to and potential program partners to think about disadvantaged communities first. So that's sort of the basis of our organization. We're sort of purpose built to support the growth of community-controlled mobility networks. So that's car sharing, that's bike sharing, and e-bike sharing, and increasingly now e-bike libraries. So sort of longer-term rental of electric bikes, as well as what we would sort of broadly categorize as volunteer transportation, sort of an alternative to the Uber and Lyft models out there. Again, sort of focus more explicitly on underserved communities. So we find that increasingly the structures that make sense are either publicly owned or nonprofit models. And so, this will be sort of the basis of my presentation, is talking through this a little bit. So next slide, please. Our experience in California really centers around two main models. One is called Blue LA, you may have heard of in Los Angeles, which is a public-private partnership, and the other is Míocar that you heard extensively about from Caroline and Abigail. So I won't touch on Míocar too much, but just to say that Blue LA, is structured through really led by a private investment, but we've got the sort of opportunity to encourage the public sector partners and encourage the private sector partners to kind of look at prioritizing disadvantaged communities. So this is 100 cars, 40 locations. At this point, about 3,000 members that have used the service at one point or another. Launched just prior to Míocar by about a year. It launched in 2018. That I would say, just to touch on, that our role and the public sector role is much more about negotiation with the private sector, in kind of tweaking that public-private partnership than it is direct operations. Next slide, please. Míocar, on the other hand, came forth as essentially as an alternative. The project partners put an RFP out, right? And really there was very little private sector interest, and certainly no private sector interest beyond the sort of the confines of the grant. So that led partners to consider the nonprofit model that I spoke to earlier. And as these programs ramp up in other places and interest ramps up in other states, we see that the Míocar model is really in some ways, more appropriate than a private sector solution or a public-private partnership. You can kind of think about this as the difference between a rural clinic in healthcare, which is almost always some form of a nonprofit model, versus, let's say, like a large metropolitan hospital, which often tends to kind of lean towards private or quasi-private operations where there's a stronger business case. So, we think there are more communities out there that are like the San Joaquin Valley, frankly, than are like Los Angeles in a lot of ways. And so we're seeing programs recently show interest, and we've been able to partner with in Stockton and Richmond in California, as well as some places in the Northeast. So I'll touch on that briefly in the next slide. Just to give you a sense of the pace, right? Really, the last year is where things have really accelerated. We've got these two programs that were years in the making. First funded in 2015, and really just getting into operations in the last two years in LA, and in the last year and a half with Míocar. And again, you sort of see things moving from the blue to the black, right? Moving from these P3 models to these nonprofit models. So in California, I mentioned Richmond and Stockton, and in New York, we're seeing programs launched this spring in Rochester and Albany, New York. as well as a program called Good to Go, the number 2, Good to Go, which we're just getting into beta testing this spring as well. So we're really seeing this grow. Next slide, please. At the state level, towards New York, towards Massachusetts. New York, like California, has had about a 15-year track record of investing in much smaller pilot programs and is gearing up to go big with this. And just to give you kind of an overall sense of scale, there's been about $100 million in public funding, state level funding, that's been essentially, for lack of a better word, put on the table just in the last year. And that represents an order of magnitude increase from previous years cumulatively. So it's a huge step up. But we think with new administration, new Congress, that it's a good chance this will see federal investment very soon as well. And so you really you have the potential to maybe double this annual investment, let's say, on a year-to-year basis. So we think this is really going to see quite an expansion in the next few years. Next slide, please. Thank you. So, what does that mean for how you run these programs? I think, there is, as you heard from Abigail, right, like community-based organizations are really at the center of making these programs successful. And, you're not going to have a self-help enterprises in every community. So some of the challenges that we're seeing is simply, resourcing these community-based organizations. So that means both direct resourcing, right? Covering capacity, covering staffing, helping provide the resources from these state level sources to encourage community-based organizations to frankly to do this kind of work, to take on the workload of these projects at the local level. But it's also about financing the practical elements of the project, like fleet. This is also kind of an all hands on deck effort, in our opinion, right? The philanthropic sector has not been particularly engaged in this work. We've got a couple notable exceptions. McKnight Foundation in the Twin Cities, E for the Future in Boston has been a terrific partner of ours, but there's room to grow that work, certainly in among philanthropy. And the same is true for the academic community. Our partnership with UC Davis, to me, is a model that we can publicize and build on, but needs to also have its peers nationally. We think of this as sort of like, so I grew up in upstate New York, rural upstate New York. So I think about Cornell Cooperative Extension for Farmers. I'm aware that UC Davis has a similar cooperative extension model. That's the kind of analogy that we think of for this work. Caroline and her team at ITS have been encouraging us to think about this as like a mobility extension, and that's going to be fantastic for California, right? We're eager to build on that with UC Davis, but as other states ramp up similar investments, there needs to be a similar model in the Northeast states and perhaps nationally as well. So that's it. I know I ran through a lot, so we're short on time, but check out us, online, and feel free to reach out if you'd like to learn more about how this work is growing nationally.
Thank you so much, Creighton. Really appreciate your broader perspective beyond kind of what's happening in the Míocar world to what's happening elsewhere in the country. We're going to transition now to our question and answer, and we have lots and lots of great questions. And Caroline, I see that you've been answering some of them in text, and I think we'll probably go ahead and ask some of them over the line too, just so everyone can hear the answers. We got several questions on just kind of asking about the nuts and bolts of how the service works, and so maybe we'll get into those in a minute. But to start with, one of the questioners and myself as well were struck by how far users are willing to travel to access the Míocar hubs. And I'm wondering if you all can speak to just what that means in terms of demand for this service, the future of the service in the San Joaquin Valley and potentially elsewhere.
I can just start. I think that suggests there is a real need for this service, an unmet need in this area. And, it could potentially suggest that we need to locate hubs in some of these other communities as well.
Yeah, I would agree with Caroline. As we were doing our outreach and enrollment efforts the past couple of years, we regularly came across people who lived in other communities that did not have a Míocar hub, and many of them were willing to go ahead and become members anyway because they wanted to have access. We started to keep track of folks who said, I want to become a member, let me know when you bring Míocar to my community. So we sort of had two running lists, right? We had those folks that are waiting for the service to come to their community. And then we had those who said it's important enough that I need to go ahead and travel there because I have really no other option at this point.
Thank you. Maybe one more question for you, Abigail, and then we'll get into some of those nuts and bolts. But can you talk a little bit in terms of the outreach that you and your organization did? Did you ever encounter pushback or hesitancy about using the service? And what were some of those factors? Maybe beyond cost or something like that. Were there other factors that made people hesitant to use the service?
Sure, I think I can offer a couple different examples of hesitancy. We didn't talk a lot about vehicle size. Caroline did review the vehicles that we have available. When we first started, we had only the Chevy Volts and the BMW i3s available, which are, of course, smaller vehicles. And some of the hesitancy we received is residents telling us they have larger families in order to, they would want to use the vehicles to take a family trip outside of the community because their current vehicle was, maybe they didn't trust it to travel a longer distance and they needed a more reliable vehicle. So Míocar would be an option for them only if it was large enough to hold, their family of 6 or their family of 8. Because of that, we did end up incorporating hybrid vans, Chrysler Pacificas, that are now available to larger families. Some of the initial resistance that we received is just that, they're electric vehicles and people have never driven them. And some people have no interest in learning, about EVs. Many folks told us that, they were intimidated by these types of vehicles. They didn't understand how they worked. So that's where the education came in, and we explained to them that, it's basically the same concept. And then I think lastly, there are folks who have a car and they say, well, I have no need for a service like this because I have a car. And they just didn't see the value in it for them, which makes sense to me. However, we did learn that some people who thought that they would not need a car because they had one, their car broke down over the year, or their spouse took the car to work and they needed access to a second vehicle. They ended up using the service when they initially thought that they wouldn't. So those are some of the things that we encounter, folks who think that there's no need for it, but then end up having a need for it, people who are sort of resistant to EVs, but all that can be overcome with just taking the time to explain.
Sure. Okay, thank you. I wonder if we got several questions about kind of how the price structure was determined, and Caroline, you had written a little bit in response to that in the Q&A box, but I wonder if you all can speak to kind of how that was decided. And Creighton, maybe you can talk a little bit about how that compares to Blue LA and whether there are maybe similar factors that went into determining that.
So we did conduct focus groups early on, and we explored prices, basically with self-help residents and also people outside the community. And we did explore some of the pricing, what people could afford, at what price they would not use the service. We really, we discussed it with project partners. I think Creighton Abigail may have more specifics on this, but we tried to keep it as low as possible and still, you know, high enough that we could bring in some revenue to sustain the service. Abigail, do you recall?
Yeah. So when we first started, like Caroline mentioned, we had some focus groups. We asked people about the price point that they felt comfortable with. And most people said that they felt comfortable paying the $4 an hour, or it's capped at $24 a day. Is that or
35 for
$35 a day? I did read in the comments that the pricing seems a little high, and you know, for some it is. But I do want to clarify that for many of our users, you know, they're using it for, you know, maybe 30 minutes or an hour in the morning to take their, you know, their grandchildren to school. And, you know, it's costing them maybe half an hour or maybe 1 hour. Most folks are not using it for a week or a month at a time, as I saw one of the questions. That's not what they're using these cars for. We have to remember that this is sort of a neighborhood vehicle. It's shared, you know, there's maybe 2 or 3 vehicles available at a site, and it's shared by many people who live in the area. So the idea is to use the car for what you need it for your short trip, so that you bring it back, plug it in, and then the next person can pick it up. They have a reservation the next hour, and it's used by multiple people. We tried to create a pricing structure that made it available for folks who do need to use the car for multiple days. However, most of our trips are shorter. Would you agree, Caroline, that they're
yeah, during this period, we saw that the average trip was, I think I presented it, was it 4 hours long? And the typical, I think it was 4 hours long and 4 miles.
Yeah.
No, it couldn't have been 4 miles. I can't remember. I have to look back at my presentation.
And just to touch on the, you know, the difference between Blue LA and Míocar, right? With Blue LA, they do tend to be shorter trips. Pricing is roughly similar, but we see a lot more, you know, hour and a half, 2 hour, 2.5 hour trips. And as Caroline's saying, you know, Míocar tends to be more like trip chaining. Can I get a grocery store trip done and go and, you know, and fit in a doctor's appointment and maybe pick my kids up from childcare, you know, all in the same like 5 hour trip. We also see that day trips, so $35 a day is our daily pricing, is very popular. Sometimes, you know, you just need to have a car around for a period of time. Maybe you have family in town or, you know, whatever the case is, there's times when it's just, you know, you're going to need a car for a few days. So that's really been something that we've kind of opened Míocar up to more than is sort of typical for car sharing programs. And I think you'll see a lot of that as these programs grow in rural and suburban communities.
Yeah, and I just looked up the figure, so it's kind of a balance between the 2 types of trips. The median reservation is 46 miles, and the duration is about 4 hours.
Okay, gotcha. Thanks. Okay, well, let's do a couple logistical questions because I think a lot of people are interested in just how these services work. So, Carolyn, I think you mentioned, but pickup and drop off of the car need to be at the same location, same hub.
Yes.
Okay, and then in terms, is insurance included in the cost? And is that, I don't know if you know what level of insurance that is. There's a question about what
Creighton can describe our insurance.
The question was whether it's the basic state liability minimums.
Is that it, Creighton?
No, it's, I mean, this is one of the advantages of the nonprofit model is that typically private models will insure only at state minimums, but nonprofits tend to, including Míocar, tend to provide much more comprehensive insurance to members. And so that's, you know, that's something that I think you'll see could continue with Míocar as it grows.
Yeah, I just want to add, I think we didn't touch on this as much as we should have. So when someone reserves or rents a Míocar, they're getting, you know, an electric vehicle that is fully, you know, maintained, serviced, and it also has insurance. And on top of that, we also provide the charging. So we do not charge the residents to charge the vehicles when they're in use. They have, cards that they can use if they need to charge it outside of our charging hubs. And so we cover the cost of that. We even have a backup for our backup that covers the cost of gas for the BMW i3 that has a small 2-gallon tank if needed. So there is no additional charge or no additional cost to the members for using the vehicles.
We also have roadside assistance, of course.
Wow.
Yeah.
I hadn't realized that about charging kind of on the go.
Yeah, when you for many people they compare, when considering what type of vehicle they want to use for their trip, they're going to compare Míocar to really a local car rental agency in the San Joaquin Valley. That's the norm. When you use one of those cars, of course you're paying for gas in addition to the cost of the reservation, and that's not needed here with Míocar.
Gotcha. Okay.
And
so
also,
a couple other.
Sorry,
go ahead.
I just wanted to mention that most of the communities do not have a rental car service in their communities or nearby.
So, and then accessibility of the service, or I guess access to the service in terms of accessibility, are there vehicles that are able to accommodate travelers with disabilities? And then follow-up question, can the service accommodate people who are unbanked and don't have a debit card or credit card?
So with respect to unbanked, we allow people to use prepaid cards. And typically we will work with them and advise them they can purchase those frequently in a local, store. And then the other question was the
accessibility for people with disabilities.
Yeah, Creighton, could you describe what we're able to provide for that?
Sure. So one of the challenges with electric vehicles is that minivans have only started to come onto the market. The Chrysler Pacificas that Abigail mentioned were, challenging vehicles to incorporate into the fleet. So as electric vehicles become more widely available, we do look forward to moving in that direction. One of our programs in Chicago, which is non-electric, has several wheelchair accessible vehicles in the fleet. So we have experience with that. It's just a matter of the electric vehicle technology kind of catching up with the need.
But Creighton, we do have, I can't remember what the features are called, the hand, what is it called?
Correct. Hand controls available.
Yes.
At the Míocar office in Visalia.
Gotcha. Okay, thank you. So we had a question early on that I thought was really interesting about just kind of how, as Míocar becomes more established, how it might be incorporated in kind of the broader transportation system, and whether, knowing that where those hubs are located, whether that might, influence transit decisions and whether transit routes might be aligned to connect with some of those Míocar hubs. And I'm curious if any of you have been aware of or involved in any discussions along those lines, or Creighton, if you have experience maybe in car sharing programs elsewhere, whether that's come up at all.
I would just say briefly that as these programs grow, state agencies are looking to kind of move beyond just a kind of a formulaic like car share program. So within Míocar, we're looking at rolling out it's just sort of still in beta testing, but we're calling Mio Ride, which is more of the kind of volunteer transportation oriented program. We're also seeing states, funding streams look at kind of an integrated package of programs. So, electric bike sharing or bike libraries, free or discounted transit passes. And so those type of programs are just really starting to get going, but we will certainly see more of that in the coming years.
Yeah, and I did, we're sharing our results with our project partners in Kern County, in one of the cities in Kern County. They have expressed interest in locating a Míocar in their transit station, because the transit, as you can see from our study, transit helps people get to the vehicles, and then you know, people can use the vehicles to go to destinations that, you know, transit doesn't go to, or they can't go to within the time. That's a big problem for people in these communities. Sometimes it takes 24 hours to take transit to get to a location and back because of infrequent service. So, you know, they saw that as a natural kind of connection.
Mike, I like this question because I'd like to share not maybe what is happening, but what we would like to see in the San Joaquin Valley. You know, at Self-Help Enterprises, and just as a person who was born and raised in the San Joaquin Valley and is very familiar with the reality of transportation challenges and needs, you know, we would like to see a network of vehicles available across the entire 8-county region. You know, the goal is for somebody that lives at a Self-Help Enterprises multifamily site to get in a car and take that car, you know, maybe to, you know, the library, drop it off there. You know, somebody else picks up the car and takes it where they need it. And, you know, that person who dropped off the car in the library, you know, can pick up a car later at, you know, at the local hub, you know, nearby. We would like it to be just a network that is continuously operating. People can drop off the cars when they don't need them, and just have access wherever they go, whether it's like Caroline said, you know, to the local transportation agency, or anywhere else. We understand that we would like to get to a point where there is just Míocars available for anybody who needs a car.
I think that inspiring vision is a good place for us to conclude. Really appreciate the three of you taking some time to share your experiences with this program with us. Hope it was useful to our attendees today. Just a reminder that our attendees will be getting a brief follow-up survey. We'd really appreciate you taking a minute to fill that out to let us know what we can do differently next time. And a final just huge thank you to our attendees, and especially to the three of you for joining us today. Thanks so much.
Thank you.
All right, well, take care, everybody. Thank you.